Hello, my name is Nia, and today I'm going to be performing a proper wound care change, dressing change. And one of the first steps I want to do, I just want to verify the provider's orders. And then once I've done that, I'm just going to grab a fresh wound care tray. Now that I've grabbed that, I'm going to head to the patient's room. I just want to provide the patient some privacy. And by closing the curtain behind me, and while I'm doing that, I'm going to introduce myself to the patient and to the patient's family. So once that's done, I'm just going to perform some hand hygiene. And after I perform my hand hygiene, I want to identify the patient with at least two qualifying identifiers, which could be their first and last name and their date of birth. So once that's done, I just want to assess the patient to see if they're for their pain level, and to confirm the last analgesic that they've had. Because ideally, what you want to do is you want to give the patient their analgesic at least 30 minutes prior to that dressing change, just to relieve any discomfort that the patient may have during the dressing change. So once that's done, I just want to explain to the patient the procedure that's going to take place, and I want to allow time for any questions that the patient may have, just to establish understanding and any confusion that the patient may have. So after that, what I want to do, I want to make sure that the patient is positioned properly um, during the dressing change, before doing the dressing change. So once that's done and I've positioned the patient properly, um, I will put on my gloves. So what I'm going to do is I'm going to put on some gloves and lock my hands just to make sure that uh, that they're on tight and snug, um, before doing the dressing change. So now what I want to do is I'm going to lift this dressing up. And what you want to do is when you're lifting the dressing up, you want to go in a parallel. You want to pull it off parallel to the skin, and also you want to go in the direction of the hair growth. And while you're doing that, you want to hold the skin down just to make sure that it's not coming up with that pad. So the you want to assess the drainage for any for signs of infection as far as improper coloring. And since this dressing is, and also you want to smell for any odor for infection as well. And since this dressing is saturated, what I'm going to do, I'm going to put it in a red bag. You also want to do the same thing with the gauze. You want to check for any signs of infection as far as improper uh, discoloration and also odor. And since this is saturated as well, I'm going to also put this in the red bag. Now it's time to unpack the wound. You just want to be careful while unpacking the wound. You just want to take it out really slowly. And since this is saturated, what I want to do is I'm just going to look at it, look for any signs of infection through the drainage, the odor, and that the coloring of the drainage as well. I'm going to throw that away in the red bag as well. So now once I've done that, I'm just going to take off my unsterile gloves, and throw those away in the proper receptacle. Okay, so now it's time for me to dye my hands with sterile gloving. So I'll dye my hands with sterile gloving. But before that, before you dye, you just want to make sure that the packaging that you're taking your sterile gloves out of, that packaging is not torn in any way, or that the packaging isn't wet. So you just before you do that, you just want to make sure that your packaging is intact before putting your sterile gloves on. So once that's done, and I've had interlocked my fingers with my gloves and make sure they're nice and snug, I'm going to palpate around that wound. I'm just going to be assessing for any pain or tenderness, and or edema around that, around that wound. And while I do that, I also want to check for any loss of skin integrity around the wound as well. And now that I've done that, I'm going to assess the patient or reassess the patient for pain. And when I do that, I just want to grab a cotton swab, a little cotton swab tip applicator, and that's going to be within this packaging here. What I'm going to do is I'm going to take this, and I'm also going to take some clear, it's like a transparent ruler sheet that's within the packaging. You can take this and you can actually measure the wound, and you can also measure the depth of the wound with this here applicator. So once you've done that, because also in the future you can look to see if the wound is healing, because you can actually check that by seeing if the wound has decreased in size based upon your last measurement. So once you've done that, you just want to throw those away, so you have that ready to go in the proper receptacle. So once you've done that, you want to cleanse the wound. So what we're going to do, we're going to cleanse the wound with an antiseptic swab. You want to go from the cleanest to the dirtiest area, which is going to be from here outward, from inner and outward, because you just don't want to introduce any new bacteria to the wound. So once you've done that, you're going to throw that away, and you're going to dry it with some dry gauze around that wound. So once you've done that, what you're going to do is I'm just going to throw away my unsterile gloves, since I've already introduced that into the wound. I'm just going to throw those unsterile gloves away, and I'm going to perform some hand hygiene, and I'm going to dye my hands with a second pair of sterile gloves. And what I'm going to do now is I'm just going to repack the wound, and in here I can bring out my sterile field with my new donned gloves. And on that sterile field, I can place my items as far as my new gauze, my tape, and just have those things close to me. And also in your packaging, you will have some saline. So what you want to do is you want to pour that saline into the packaging, because it has a container for it, and we're just going to do that wet to dry dressing, and we're just going to kind of get that. We're going to have that, put that in the saline, and we're just going to drain it a little bit so it's a little damp, because you don't want it to be dripping, but just damp. And you're going to put that into, you're going to pack that into the wound. And for the purpose of this video, I'm going to pack it in with my gloves. You can also pack it in with the sterile with the cotton tip applicator. You can just push that in as well. Either or. And then once you've done that, you can throw that away. So once you've done that, now it's time to put some new gauze on the wound on top of that. So just going to place that on top of the newly packed wound. And once you've done that, you're going to use a new ABD pad with the line up. And you're going to place that on top of that wound. And you're just going to tape it down with some tape. So once you've done that, you want to make sure, which is important, you want to make sure that you label the wound. So when you label the wound, you're going to put it on top of there, and you're going to label it with the date, time, and your initials, just so the person after you know when the last time the dressing was changed and who changed the dressing. So once that's done, you can actually take off your gloves. You just want to take off your gloves, throw that away in the proper receptacle. And once you've done that, you want to make sure that the patient is comfortable. And also, sorry, with the gloves, you whatever else trash that you have around you, you can also throw away as well. So once you've done that, you're going to uh, just make sure the patient is comfortable. You're going to make sure that call light is in reach, along with any personal items that they may have. And you also want to raise the side rails just to decrease any fall risk, and lower the bed to the lowest position as well. Um, and before leaving the room, you want to perform your hand hygiene and document. And that is the dressing change.